Welcome to tonight's Facebook live chat on mental health and IBD. My name is Orna Ehrlich, and I am Senior Director of Professional Education and Innovative Programs for the Crohn's and Colitis Foundation. Living with IBD not only affects your physical health, but your mental health as well. Research shows that rates of anxiety and depression among IBD patients are 2 to 3 times that of the general population, and up to 32% of IBD patients may experience post-traumatic stress symptoms. Tonight, we're joined by Dr. Eva Szigethy from the University of Pittsburgh, an IBD patient, Parsa Iranmahboub, a member of the Foundation's National Council of College Leaders. Welcome, Dr. Szigethy and Parsa. Over the next 30 minutes or so, we're going to discuss the impact that IBD can have on patients' mental health, as well as recent research that shows psychiatric illnesses are drivers of cost for IBD patients. We want this to be interactive, so please comment below this video, tell us who you are and where you're from, and of course, don't forget to ask questions. Please remember that the information provided during today's chat is meant for educational purposes only. The views shared during today's chat do not represent the official position of the Foundation. If you have thoughts of self-harm or suicide, please do not hesitate to reach out for help by calling 911, going to the closest emergency room, or calling the suicide hotline at 1-800-SUICIDE. With those disclaimers out of the way, let's get started. Dr. Szigethy, what are some common mental health issues IBD patients might experience?
Thank you, Orna, and thank you for having me here today. So I'm so glad that you called them issues and not diagnoses or disorders, because we know that having inflammatory bowel disease takes a tremendous toll on the body, and the body and brain are integrally connected. And so it's not unusual for patients, both during times of flare or during times even when they're in remission, to have anxiety. And anxiety can be either anticipatory worry about things, it can be hyperarousal, so just panic and finding their bodies more reactive to stress. There can be symptoms of depression, and especially when there's inflammation going on in the body. And then, having IBD is traumatizing. And then if you have life events that are hard, or life events that are traumatizing or raise arousal, and we certainly have a lot of example of that now, it can just sort of amplify our emotional reaction to things. It can make our thinking more negative. And so I think it's important that these things can happen, and you can have a higher susceptibility to these things happening when you have an inflammatory disease like IBD.
And how come IBD patients experience mental health issues at a greater rate than the general population?
So that's been particularly shown for anxiety and depression. And I think threefold. One, the biochemical reaction. Inflammation in the body is messaged chemically to the brain and can make the brain, just the threat response, both to what's happening in the body and the outside world, greater. It can be reactive, and reactive just making it harder to cope with what having IBD throws at you, what life throws at you, and then particularly now. And I would just say with everybody sort of heightened arousal with COVID right now.
Mm-hmm. And Parsa, how has having Crohn's disease affected your mental health?
Well, thank you for having me, first of all, Orna, and quite a loaded question, to be honest. But let me first give the audience a little background. As an IBD patient, I was diagnosed with Crohn's disease in 2008 at the age of 8. So quite some time ago. But I basically grew up with IBD, with a chronic illness. And when you have a chronic illness, there definitely is, a large mental burden that is placed upon the patient. And, through my experience, I would say there are 4 really distinct feelings that I myself have felt because of IBD. Anxiety, embarrassment, guilt, and loneliness. And so with anxiety, there is this anxiety of this feeling of this disease taking over my life. With having a bathroom disease, there's that, this association with, I have to keep on going to the bathroom. With diets, one of the medications I used to take, I had to be on a low sodium diet. And so when I would go out to eat either with family or friends, there was this anxiety of, well, can I even eat anything from this restaurant? There's also the anxiety that comes from extraintestinal manifestations. Before, I've had quite a few periannual fistulas. And so when I think around my second year of college, when my labs were not looking too good, I was flaring a little bit. I got really worried that I might have another fistula. And so, I started to worry about, okay, well, what does this mean in terms of how I can accomplish my work? What does this mean in terms of if I need a sitz bath, how does that work? I live in a communal style dorm. And so, that anxiety can be very difficult for patients. There's also the embarrassment component, where not only from it being a bathroom disease, but also from flaring, from when you lose weight, when you don't look healthy, when you look a little sick, when you feel like this is not myself, and what people see, it's not my true self. And so there's also the side effects from drugs. And a common example that I give is from the extraintestinal manifestation. So I believe it was around middle school, 6th, 7th grade. I had a periannual fistula and I had surgery. I had a Ceton to help drain the pus. But after the surgery, I had to wear tighty whities and a maxi pad. And it might sound silly right now, but man, I hated PE because we had to change to our PE uniforms. And I was just embarrassed. I was embarrassed of, having to wear those tighty whities, of having, that visible, maxi pad. It was embarrassing. And, in 6th grade, 7th grade, you're trying to look cool in front of your peers. And it can be very, very difficult. And then that leads me to guilt. There's guilt through feeling like you're being a burden for others. When you're hanging out with your friends and you can't do this because, oh, I need to go somewhere where the bathroom's very accessible, so I can't go hiking with you guys. So you'll have to be flexible with me, or I can't go to this restaurant because, yeah, end results will not be pretty. There's that guilt, but there's also the guilt of a non-compliant label. And so an example I give is I used to take this medication that made me incredibly nauseous. And so I was so afraid of this pill that I would refuse to touch it. I would take the pill container, I would open the lid, and then I would just slowly pour out all the pills. And then throughout the process, not touching a single pill. And so it might come to no surprise that eventually I became non-compliant. And because I became non-compliant, I had to switch, medications. And the next medication I tried, I developed acute pancreatitis. I went through that. And so I had the guilt of, why was I being non-compliant? Why could I not get myself to just take these simple pills? And then on top of that, there was this guilt of, when I developed the acute pancreatitis, of, I did this to myself. This was my fault. And not only did I put myself through that, I also put my family through that. I remember I felt so bad. I was at a point where I was like, I was with my father and I told him, I think I'm going to die. I was at that point. It was a feeling I never felt before. And I told, him that verbatim. And I'm sure no parent wants to hear that from their kid. So there's definitely a heavy sense of guilt that could be associated with IBD. And that also brings me to loneliness. I think one of the amazing or unique components with IBD is this idea of an invisible disease, which can be both a blessing and a huge curse. It can be a blessing because you can simply put on that mask and, others don't know what you're going through. You're not vulnerable to them. They can treat you like they would treat anyone else, which can be, a very nice feeling to have, especially as a chronically ill patient. But on the flip side, with an invisible disease, it can be very, very challenging to feel like you're part of some sort of community, to feel that, that you belong, that you have shared experiences. which brings me to a story where I was looking into an Instagram story from a Crohn's and Colitis Young Adult Network fellow. And he mentioned how this medication, the one that I couldn't touch, put the fear of God in him. And so at that moment, it really made me realize that I wasn't alone, that this, patient also became non-compliant with this medication. But without, having that sense of community, without hearing that Instagram story, I, would not have known that. And so there can be feelings of loneliness associated with IBD.
Oh, thank you so much, Parsa, for sharing your stories and all of those components. It's really impactful how you presented that. Thank you. So talking about how you are doing mentally can be hard for some people. Dr. Szigethy and Parsa, what advice do you have to help patients start the conversation about mental health with friends, family, or their care team? We can start with you, Dr. Szigethy.
So before I move on too, I still want to pause with Parsa's powerful story. And, I think the trials and tribulations in your young life you've already faced, but I think also the resilience and the inspiration and, you're graduating from UCLA, you're looking toward medical school, that while sometimes you have to take pauses, detours, and have, like you called them so beautifully, those hidden challenges, success is also possible. And I mean, your persistence and your passion just, comes through even when you're not talking about the things you're passionate about. So again, thank you for sharing that. In terms of, Orna, to your question about treating mental health issues, I really think that it's all about empowerment. And even though I'm a psychiatrist, I really, and I'm going to say this several more times through this session, I think it's so important not to give people additional diagnoses. Having inflammatory bowel disease is enough. And yes, sometimes you have a set of symptoms that meet a checklist that we call a disorder. But I think really empowering people to really decide what they can and can't control in their lives, and then really set their actions and aspirations accordingly for the things they can control. And when things happen we can't control, the power of the mind, the power of positive thinking, and to Parsa's point, the importance of social support to get through that. So I think sharing your story, getting validation, reaching out to the wonderful kinds of resources available from the Crohn's and Colitis Foundation, and I know you'll be talking about those in more detail, but I think that that's sort of the starting point. And then I would say, in a general way, recognizing that there are experts out there, even your GI providers who specialize in IBD, nurses. There's certainly more and more IBD centers that are having social workers or some kind of embedded behavioral specialist, that these folks can help you. And it's a sign of strength to be able to recognize that you're struggling and know that we can do a lot without adding another medication to your regime. So of course there are antidepressant, anti-anxiety medications, but I think that there's so much that can be done just with learning some coping skills to reduce arousal, to help when those, when thinking gets unduly negative, and really to keep you engaged with your goals and always looking past those obstacles.
And then I would love to add on from a patient perspective, just echoing what Dr. Szigethy mentioned, this idea of a support network. I think, really the first step, at least the first step for myself, was to know that I was not alone, that, that this was a psychosocial component that, exists with IBD. And even though I was diagnosed at such a young age, it took me about 10 years, about a decade for me to really open up about my story to, beyond just my parents and, my immediate friends. And once I started to hear the stories of others, once I realized that, there is an IBD community that's out there that, in some ways understands what I've gone through, what I am going through, that shared experience is just incredible. And it really helped me to open up and to feel more comfortable to share my story and to, express my concerns with my medical team, further express them with my friends and my family.
Great, thank you. So Dr. Szigethy, I know you started to talk about some of the ways that we can treat mental health issues in IBD patients, but just wanted to see if there were any additional methods that you wanted to raise during the Facebook Live.
So, when you do turn to sort of what are the most supported treatments, mindfulness meditation, and sort of having that 10 minutes a day that you devote to it can be just breathing exercises. It can be now done digitally with apps such as Headspace. So really knowing that the power of getting in that state of mindfulness, acceptance of the moment, and making it part of a daily habit can be helpful. One of the most effective antidepressants is starting each day with a gratitude journal. So especially during our toughest times, or especially when people are feeling sick from their IBD, like having that powerful positivity as the thing that sets the tone for the day. More and more studies are showing that it truly actually, the brain can be an ally for the body to fight inflammation or hold it at bay when we're in remission. If you're working with mental health professionals, medical hypnosis is safe and extremely effective and has especially helped with the anxiety that can come with different aspects of IBD, and also if there's chronic pain. And then the approach that probably has been most studied as a therapy is cognitive behavioral therapy. That's a fancy way for, again, helping people identify ways to problem solve using the power of their thinking and the power of being active, in healthy ways.
Great, thank you. Parsa, what have you found most helpful in coping with the stress that you experience with your disease?
Yeah, so coping mechanisms have been, a big thing. And so for myself, exercising, whether it's lifting weights, going on a jog, or even a walk with family or friends, hiking, working on my hobbies I'm, passionate about, right? I just enjoy doing, whether it's cooking, I like to believe I have a green thumb and that, I'm somewhat good at gardening. So working on that, journaling. Yeah, I can definitely echo how journaling has really helped me. It's just really reassuring to have a space to just completely express your thoughts, to write down whatever you want to without, feeling like you're being judged. And then, of course, meditation is really big, whether it's through yoga, praying, or just repeating a mantra, either early in the morning, at night, or whenever you're feeling stressed out. But in addition to just coping mechanisms, once again, one of the best ways that I've dealt with, this topic is through that shared experience. And so, support networks, they are amazing. Whether it's through your local chapter, or if you're a college student like myself, you might have a club at your university. But also resources from the Crohn's and Colitis Foundation, like Power to Meet, these platforms where you get to, meet people who might have, a similar experience. They're really powerful in terms of, coping, with certain situations.
Great, thank you. Dr. Szigethy, earlier this year, you co-authored a paper that discussed that one of the biggest drivers of high costs is psychiatric illness, like anxiety and depression. Can you share a little about the study's findings and why psychiatric illness drives up the cost?
Absolutely. So this was a project that was a partnership between the Crohn's and Colitis Foundation and Optum Insurance. And we looked at claims data over a 10-year period for about 53,000 patients with IBD to look at the cost drivers. And what we found is that mental health made the list of the top 5 cost drivers. Now, certainly certain medications like biologics, actually patients who were on systemic steroids had greater costs, those who were taking narcotics, those who were using medical healthcare utilization due to relapsing disease, anemia, those were also drivers. But the fact that mental health made the list, and again, this is claims data, so these are the codes that doctors put when they submit for payment for visits of various kind in healthcare system. 28% or over 14,000 patients coded for at least one mental health condition. The most common conditions, and again, this is across the country and across a 10-year span, was depression, anxiety disorders, substance abuse, and bipolar disorders. And when costs were compared between that 28% who had at least one coded mental health condition and those that were not, really across the board, but particularly in emergency room costs and inpatient costs, surgical costs, pharmacy costs, those that had a mental health condition, was significantly higher. And I think that it's so important that, in a way, this was a cost analysis paper, but it was really much, much more showing the power of, again, when the mind is sort of offline because it's so stressed or it's depressed, that it's not there to be an advocate, to help the body heal. And I think that's so important because one of the strongest connections in our bodies are the brain-gut connection. And I think to me, this paper signifies, again, how much the emotional distress contributes to the medical aspects of treating IBD, and that, I sort of invite my patients to really think and talk about when they're having anxiety or stress symptoms or depression, truly as the extra-intestinal manifestations of IBD, the same way they think about when they have joint issues or skin problems or conjunctivitis.
Great, thank you. Parsa, in addition to seeing a mental health professional, what resources are available for IBD patients and caregivers to get support in their IBD journey? I know you started to list some, but if you can expand on that, that would be great.
Yeah, no, great question. One of the biggest ones, obviously, friends and family, if you feel comfortable. And then you have your support networks, Power to Meet, your college club, through your local chapter or through the foundation. And if you're a college student, there are centers for accessible education, which can really help you, get a few accommodations. I know for myself, I get infusions. And so for myself, that stress of making sure that, I have somewhere in my schedule room to get, those lengthy infusions, it's important, and it really helps alleviate that pressure, that stress. I know a few others who might get extra time, or, if you're flaring, you might be in remission now, but you never know when you're flaring. And if you're flaring, college itself is already difficult, add a flare on top of that, and wow, it becomes incredible. So, there are definitely a lot of accommodations you can get through your center for accessible education.
Great, thank you. Dr. Szigethy, how can a patient find a mental health professional who has experience treating IBD patients?
So the best place to start is with your gastroenterologist. More and more sort of IBD centers, and I know those are more at big institutions, have formal mental health services that are integrated or at least coordinated with the gastrointestinal care. If your gastroenterologist doesn't know any providers, your primary care doctor likely does, because the AMA actually just put out a big notice today about how they're going to support a collaborative of getting behavioral health integrated into primary care across the country. But many primary care docs are already there. And then, the Crohn's and Colitis Foundation, your resources, and the network of providers that you have available, I think is also another place to go.
Great, thank you. Dr. Szigethy and Parsa, do you have any final advice or tips to share with IBD patients who may be dealing with mental health issues? Parsa, I'll start with you.
I mean, I can just reemphasize the power of finding a community, of realizing that you might not be alone, that it might be a shared experience, and really looking for those shared experiences. It's something that has definitely helped me to open up, and it can be incredibly powerful for that psychosocial component that is associated with IBD.
Great, thank you, Dr. Szigethy.
So I'd like our audience to question themselves about the 4 S's. And my 4 S's are, how are you doing in self-advocacy about your emotional wellness, and letting the right people know when you're not feeling well. And you know what? It doesn't have to be not feeling emotionally well for days or weeks at a time. Even that off day, just really reaching out and making sure that you're getting all the help you need from the right people. And sometimes it's your friends, sometimes it's your family, and sometimes it's a professional, but really checking in about that. The second S is your stress management strategies. And I mean, not just for when things get really, really bad. What is your daily way that you're managing stress and you're preventing stress? You're building those layers of resilience against stress. And Parsa mentioned, many great ways that he does, and those are tried and true. And, it's okay if you come up with your unique things that you do. The third S is, how are you sleeping? Even if you don't have IBD, 7 to 9 hours, so 8-hour average is what is recommended by every single sleep society. And yes, if you have an ostomy or you're in the middle of a flare, you might not be able to get that all in one chunk, but that's still the amount that is optimal. And there are lots of things that we all can do to self-sabotage our sleep without even knowing it. So really, again, checking in with professionals if your sleep, is extremely impaired, but just taking really, really good care of your sleep time. And then the last but not least, and I think this reinforces, what Parsa said a number of times, is the importance of social connection. So even during these times of social distancing, especially during these times of social distancing, keeping connected, even if we have to be more creative, doing it virtually, even forums like this that are virtual, making sure that you really have a go-to support network.
Great, thank you so much. So that's unfortunately all the time we have for today's mental health Facebook chat. Thank you to everyone who joined us, and especially to Dr. Szigethy and Parsa for sharing their experiences and expertise with us. Dr. Szigethy and Parsa, any final remarks?
Just thank you for having me, for allowing me to share, a few of my stories, a few of my experiences. And, I'm really happy that we are talking about this topic. A lot of times I feel like we associate IBD with just a bathroom disease, not the whole psychosocial component. And I'm happy that, as an IBD community, we are doing that, but also as, a general population. And so I think we're definitely heading in the right direction, and it's exciting.
Great, thank you. If you have any additional questions that we didn't get to tonight, please contact the IBD Help Center at info@crohnscolitisfoundation.org or 888-MyGutPain. We have some additional upcoming Facebook chats, and join us please on October 20th at 8 p.m. Eastern Time for an ulcerative colitis 101, and on October 27th at 8 p.m. for Crohn's disease 101, and finally on November 10th at 8 p.m. Eastern to learn about how to be an effective partner in your IBD care. Have a great night, everyone. Thank you.